Talk a little bit about your background and let me learn more about you.
Well, thank you. I am a clinical research psychologist, and coming here from Beacon, I really was very happy and proud to be a part of things over the last 5 years as we really built a high-performance analytic and innovation team and really tried to have an integrated approach really across everything that we were doing and bringing together all the information that we had as the administrative service organization for Medicaid to disseminate as much as possible information that providers might need to take action or our state partners might need to help really drive informed decision making. So it really was something that I am very proud of, and I really treasure the colleagues that I have. Another program that I was worked on deeply while I was at Beacon was the Connecticut Behavioral Health Homes with DEMIS and our other state partners. And a large part of our focus was really supporting the behavioral health home providers in seeing a whole person, including both their behavioral health and their medical needs and challenges as well. And so there was a lot that we needed to do to make data flow from systems that providers were using and data that DEMIS had, and combining that with information that we had with behavioral authorizations and also Medicaid claims for behavioral health, medical, pharmacy, dental, and really try to give information to providers so that they could really address a wide range of needs that the individuals that they were working with had. And we also worked very closely with Advanced Behavioral Health, ABH, and also CHN as well, to really try to bring all the insights possible to the providers. And it really is something that inspired me to come and join liberation programs and get back to kind of boots on the ground in the community.
Excellent, excellent. So as our new Chief Program and Innovation Officer, what are some of the ideas you have in taking some of the practices that you've had in the past and applying it to the work that we do here at Liberation?
Right now, I'm definitely in a phase of really learning all that we do and getting to know people, and excited to keep going back out to the wide range of programs that we have to keep meeting the people who work there and as you said, our recoveries as well. And really learning kind of what we're doing now, and in many ways some of the innovations will be within liberation programs and just making sure that we're sharing all of our own best practices across programs. I would say that there's also innovations that I think we both share of really trying to keep pushing the forefront of recovery coaching, including specialized recovery coaches as well, to really kind of best serve the needs of the folks we work with every day.
Excellent. Excellent. What are some of your strategies in working with what we know about implementation science and being able to infuse some of these evidence-based practices into the workforce and the staff that you'll be working with?
I love the question. I think it just you can't talk about evidence-based practices or even best practices without really an implementation science approach. And really, one of the things that makes you do is take that step back at the beginning and do as much kind of thoughtful preparation and planning as possible if you're implementing something new, or even if you're just trying to really enhance and have a process improvement approach for work that you're doing. So a lot of collaboration, a lot of discussion, and a lot of really trying to flesh out workflows and help support people in doing the work.
What are some of the opportunities you see that lie outside of liberation programs for community partners?
Mm-hmm. I would say this is definitely another reason that I was so attracted to this opportunity. I live in Fairfield, so as a member of Fairfield County, I really saw organizations like Operation Hope doing such great work that sometimes I think people outside of Fairfield County don't always appreciate the range of needs that we have. And so I think partnering as much as possible, even more closely with the hospitals. I think it's great that Liberation has been so active on our community care teams. That's something that also at Beacon we really tried to help support when it was just getting going. So just even deepening the relationships with the hospitals and with other providers, and also the nonprofits that are working with kind of across social determinants of health.
So, I know you and I share the same passion for involvement of family, and you've done some work with partnership in the past. Can you talk about how you'd want to increase some opportunities for engaging families with the people, with those who we work with?
Sure. I think that one more thing that really attracted me to liberation programs is that you really have so many special programs that address end to end. So we have prevention programs in Greenwich for youth. We have outpatient, inpatient. Our FERP program, our Families in Recovery program, is so unique and so special about really even understanding how our recoveries need support in being parents and caregivers themselves. And so, especially with medication-assisted treatment, it's so critical to involve families in supporting the recovery and really making sure that they understand that this is very often a long-term journey, a long-term support. And just like with diabetes and you need insulin and exercise and nutrition, in medication-assisted treatment, it's often a very similar long-term, multifaceted journey. And having family involved has really been shown to increase engagement and enhance outcomes.
With this changing landscape of healthcare, what do you see we need to do to become more in line with the future of healthcare for our recoveries and their loved ones?
I think you and I share a lot of the same passions in this area as well, including thoughts about when we talk about behavioral health homes, recovery health homes as well, and really, again, having a holistic view where, in thinking towards moving towards value-based payment, that there are very non-traditional supports that we know are really effective that can be woven in with more traditional and traditionally reimbursed clinical treatments, and really trying to make sure we're bringing to bear multidisciplinary teams and approaches to helping support our recoveries.
Now tell me a little bit about Bonni, the person outside of Dr. Hopkins, living in Fairfield, Connecticut. What do you do in your spare time? What passions and hobbies do you have? And tell me a little bit about you.
I do love I love the work that we do. I'm very mission focused, so I am very busy. But I've been married over 25 years, and I have 3 kids. My daughter is 16, and my sons are 19 and 21. And we have 2 very energetic rescue dogs, so that all keeps me pretty busy. And I think the thing I love the most are family celebrations. I love big family parties and baking and having everyone together.
Did you grow up in this area?
Oh, I grew up in New York City, so nearby.
Okay.
And
Actually, in Manhattan.
I met my husband at Stuyvesant, so high school sweethearts. But so I grew up in New York, and actually lived experience really brought me to this field overall as well. I think it does for almost everyone. I think
absolutely.
It makes you really attune with challenges and needs. And my dad, Norman Fisher, he passed away just about 6 years ago, and he had 25 years in recovery.
Wow.
And just when you think about family, it just meant everything to all of us.
So like for most of us, this is more than just a job for you.
Absolutely, absolutely. And just really be proud to be a part of the team.
That's awesome. Well, thank you for your time.
Thank you so much.
Yeah.